Hello, and welcome to the Medi UK UCS debridement virtual training. My name is Natalie, and today I'm going to talk you through how to improve wound cleaning and debridement with UCS. UCS is the only ready-to-use debridement product that offers single application treatment combining an active solution with physical debridement. The loop fibre technology found in the cloth enables the disruption and removal of the physical barriers to healing, such as slough and biofilm. Allantoin, the mild keratolytic and moisturiser in the solution, helps to soften any dry and hardened skin, making it easier to remove, while adding moisture back to the wound bed and peri-wound area. A key ingredient in the UCS cloth is the surfactant Pelaxima. The surfactant enables the gentle capture of the bacteria and devitalised tissue into the cloth from the wound surface or skin, which can then be safely removed. When the UCS cleanses the skin, it leaves behind a residue of surfactant, which reduces biofilm reformation and encourages healthy cell regeneration. The final addition to the cleaning solution found in the UCS is aloe vera. Well known for its soothing, anti-inflammatory and moisturising properties, makes it the optimum solution for chronic wound management. There are many reasons why physical debridement with UCS may be required. For general wound cleaning, UCS provides fast, effective and a simple solution compared to traditional methods. It can be used to aid wound assessment when wound depth or tissue structures are masked by devitalised tissue such as pressure ulcers. When managing wound bed preparation, UCS offers a simple solution to every step of the Times wound bed continuum, from removal of necrotic tissue and reducing bioburden in chronic infection to aiding moisture balance and improving surrounding skin. For every issue identified, UCS can offer a solution. And finally, UCS offers the perfect anti-biofilm strategy, offering disruption, removal and prevention of recurrence without the need for antimicrobials. UCS is easy to use. Simply open the sealed foil packet and unfold the sterile cloth. Taking a small section of the cloth, use a gentle circular or polishing motion to begin to clean the wound and the surrounding area. UCS offers moisturising properties as well as wound cleaning, which allows it to be used on the wound and peri-wound area without damaging healthy cells. You can use both sides of the cloth to lift the skin plaques and clean the wound bed. UCS is particularly easy to use in cavities or hard to reach areas such as in between toes. Once you have finished using the cloth, there is no need to wash off the solution. This allows the active ingredients to continue working until the next dressing change.
There are many barriers that affect healing of wounds. Gently wipe them away with the all-in-one UCS debridement cloth from Medi. Wound debridement at an early and appropriate stage is likely to accelerate wound healing and improve patient care. The UCS debridement cloth is unlike any other debridement product on the market. Each cloth is pre-moistened with a solution that contains a skin-friendly surfactant and allantoin that softens hardened dry skin and cleanses deep into the wound bed. It is ready to be used straight from its pack. The non-woven viscose cloth is effective in debriding wounds, whilst the solution cleans and hydrates the wound bed and the perilesional area. Here's how it works. The UCS pre-moistened cloth softens necrotic tissue, plaque, fibrin and slough, trapping debris and biofilm in its fibres as it moves, effectively cleaning the wound bed and providing a healthy environment for the wound to heal. The UCS debridement cloth is gentle on patient's skin, helps to reduce the odour of wounds, and is used to clean and hydrate the whole limb. UCS is safe and easy to use by both medical professionals and patients themselves, and it does all of this while supporting the healing process. The UCS debridement cloth can be used across all clinical settings for the debridement and cleansing of acute and chronic wounds, peri-wound skin, skin conditions, and static wounds to remove suspected biofilm. UCS can also be used as first aid when cleaning trauma wounds. Each cloth comes in an easy-to-open sterile foil pack and is supplied in boxes of 10. The UCS debridement cloth. Debridement made cleaner and easier.
Now it's time to explore UCS in action with the use of patient case studies. This case study shows how UCS can be used at a dressing change to aid the removal of devitalised tissue. As only a clean wound will go on to heal, sloughy tissue in a wound is a barrier to achieving wound healing. In this case, the nurse used a UCS cloth for a couple of minutes. You can see how a large proportion of the slough has now been removed post-UCS. The wound reveals a much healthier granulation tissue underneath. This is the perfect illustration of how the surfactants in the solution work to lift and remove the debris from the wound bed. Here we see images of a 72-year-old gentleman with a non-healing diabetic foot wound post a transmetatarsal amputation. The wound had been non-healing for 4 months with a history of recurrent infections and wound deterioration, treated with multiple antibiotic treatments. The patient had been managed with various desloughing and antimicrobial dressings, but with little improvement to wound healing. A care plan was developed for the wound to be debrided with UCS debridement cloth 3 times per week, in conjunction with autolytic debridement dressing regimes. The improvement in the wound edge advancement following the implementation of an anti-biofilm plan with UCS are demonstrated in the images here. The patient reported a reduction in exudate levels and no further episodes of wounds infection. Skincare in lower limb conditions is hugely important. In the first image here, you can see a leg with a severe buildup of hyperkeratosis in very poor condition. On first assessment, the legs were covered in large plaques of hyperkeratosis, and it was very difficult to assess for any wounds due to the condition of the skin. A daily skincare regime was initiated, cleaning and debriding the skin with daily use of UCS debridement cloth and daily application of emollients. After debriding the hyperkeratosis, full visualization of the limb was enabled, as seen in the middle image on the screen. Some areas of skin loss were identified. And the final image shows the leg again 10 days after the first image following the commencement of the new skincare regime. The soft, supple nature of the cloth means it's so versatile it can be used in a variety of difficult to reach areas. Because the level of pressure exerted can be easily felt by the user, it's perfect for painful or difficult to see wounds. It can be rolled and used in a cavity or undermining wound, or even folded for use between toes and skin folds. UCS is a Class 2B medical device, which means it can be safely used on internal body cavities as deep as bone. Its versatility means it can be used on a wide range of conditions, from chronic lower limb wounds to acute burns. So why use UCS? As you can see, there are multiple benefits for both the patient and the clinician. For the patient, the cloth is easy to use, allowing patients to look after their wounds and the surrounding skin independently. For clinicians, UCS offers a simple, accessible and easy to use one-stop wound cleaning and debridement option that's unique, convenient and safe. Thank you for listening. For further information, please contact the MediUK clinical team at inquiries.clinical@mediuk.co.uk.